Okay, so now we're going to talk about computed tomography, or CT scanning, which is a new-ish X-ray based technology that came into use in the early 1970s. So what we're going to do is we'll first talk about kind of the basics of how it works, and then we'll move into talking about some of the advantages and some nuances to know about how to interpret CT images. So here you can see an image that basically demonstrates what happens. So you have an X-ray beam located here, which is able to rotate around in a full 360-degree circle. And located on the opposite side of the X-ray beam is a large array of detectors. And so the detectors in the beam, they rotate simultaneously so that the beam is always on the opposite side as the detectors. And so the beam passes through the patient and then is picked up by the detectors on the other side. And then as the X-ray beam and detectors are rotating around the patient 360 degrees, the table that the patient is sitting on moves through the CT scanner. And so as a result, you get these slices that are created throughout the entire length of the patient's body. So we're just going to watch a quick video here on what a CT gantry actually looks like. So here you can see this large setup. Here's the bed that the patient would be sitting on. This is the little donut hole where they pass through. And then you can see what's spinning right here is the X-ray beam and the detector array within the gantry. And so again, you can get a sense of how this spins around the patient. So the patient would be kind of sitting right through here and would basically just move through the CT gantry. And so as it goes, you're getting a large number of images during that process. So the patient cannot see this. This is all usually hidden from view, but in this case, in this video, you can actually appreciate what the CT gantry looks like and really how fast it actually spins. So these scans are very, very rapid. We can actually obtain them within approximately 30 to 60 seconds, including for the entire body. So again, it's a very rapid process, which makes it appealing, especially in an emergency setting. All right, so talking about now why CT? What are the advantages of CT over X-ray? Some of them include a significantly enhanced resolution. So if you look at these images across here, you can hopefully already appreciate that the resolution is far, far better than what you get on an X-ray. You also get multiple views of the body from one scan. So this is a huge advantage because instead of having sort of a 2D projection of 3D structures, now you actually get a full three-dimensional view of the body where structures aren't overlapping on each other. So you're looking at progressive slices of the body, which is much, much easier than to appreciate the anatomy and frankly pathology and injury that might occur throughout the body. We also have significantly enhanced data manipulation capabilities, so that includes windowing as well as 3D rendering. So you can see down here a 3D rendering of a CT scan of a patient that has COVID-19. If you want, you can actually watch this video here that I put a link to on the slide where it actually shows you, kind of walks you around this CT scan. You can see how some coloration's been added to it, so you can appreciate where the COVID-19 pathology can be seen within the lung tissue itself. So the other advantage as well is appearance of objects where they really are in space. So again, you can appreciate where all the anatomy is exactly where you'd expect it to be, not overlapping each other like you see with a typical X-ray. So again, it's huge that you don't have that overlap. And then again, you get these multiple views. So not only do you have axial or cross-sectional views, but you can also see sagittal and coronal views all from a single image. So you don't, or a single scan, you don't have to go through and get these different positions of the patient like you do with X-ray. You just do it one time and you can get any view that you could possibly want. So that probably leaves you thinking or wondering, why in the world do we still use conventional X-rays? Why is that 75% of the radiological scans that are performed if CT is so much better and from a user perspective? And the reason is that CT exposes patients to 10 to 100 times or more the ionizing radiation that a conventional X-ray scan does. So it's an immense amount of radiation that a patient is being exposed to with a CT. And so since CT scans are based on X-ray beams, the appearance of tissues on CT are basically the same as for X-ray studies. However, due to the computer manipulation, there can be some deviations from that of X-ray. So for example, I'm going to go back here for just a moment. This top image here, you can appreciate that this is the same image with 3 different windows. So on the upper left, this is where the window is optimized to see more air-like structures, so the lungs are best appreciated there. And this one, mediastinal structures are best appreciated, which you can see circled here in the middle. And then finally, this is the bone window on the far right, where then you can appreciate bones better on this type of window. So again, you get this really significant enhancement and the fact that you can manipulate the data once it's obtained in order to appreciate different structures. And we'll look at this a little bit more later on in the course. So in terms of the way that the CT scanner works, again, it's basically using the way that the X-ray is absorbed through the body, and then there's a set of software algorithms that then convert that into a pixel on the video display. And then the way that it does that is it uses a system of or a measurement unit known as Hounsfield units. So the Hounsfield unit is the unit for X-ray absorption in CT. And so the way that this is set up is the Hounsfield unit for water, or the Hounsfield density of water, is 0. And then tissues that are more dense are going to be positive. So you can see with bone being the highest Hounsfield unit because it's the most positive. And then you can see that air is by far the most negative because, again, obviously that has the lowest density compared to anything else. And so that has a Hounsfield unit of -1,000. So the scale can be manipulated then to allow for the windowing process that we just talked about. So here you can get a sense of that windowing. So this is where you start, and if you shift it to the left, you can see that now you're going to be able to see the lighter structures, like air. So lung tissue is going to be best viewed when you shift the Hounsfield units to the left. So we call that a lung window. And if you shift it to the right with a bone window, you can see that now you're going to be able to see the high density bone is going to be accentuated, and so it'll be easier to appreciate when that's done. Okay, and so then just another note on this. If you look at the sort of way different things appear on CT, a couple to point out is number 1, acute hemorrhage, contrast media, and calcifications or bone are going to appear hyperdense or bright on CT. So again, very similar to what we talked about with X-ray, whereas the hypodensities or dark structures are going to include chronic hemorrhage as well as edema formation. So those are just a few important points to keep in mind. Of course, this course is more focused on the anatomy. So thinking more along these lines, calcifications, contrast media, etc., are going to help us. Whereas these other things like chronic hemorrhage, edema, acute hemorrhage, these are the sorts of things that we're going to be looking for that are going to be useful clinically when trying to diagnose a patient. So I just want to give a couple of examples here of some of the windows. So you can see this is a CT without contrast, and this is a bone window. So you can see this is the cranium, which you can appreciate quite well. And then notice now with a brain window, all of a sudden, boom, there's the brain, which you can appreciate quite well. Here's an acute hemorrhage that you can also appreciate as a hyperdensity over there on the right. But again, keep in mind, this is the patient's left. So it's on the right-hand side of the screen, but it is on the patient's left. Here's another brain window. So again, good thing to kind of look through the brain and see what you can observe. And you'll notice up here where we have a fracture, you can see some swelling overlying that fracture as well. And then now with the brain window, you can see a bit of an acute hemorrhage that has formed right in that region as well. And then finally here we have a CT scan that's been 3D rendered. So now you can see this cranial defect located right here on this particular individual. So just a couple of notes in terms of the way that we view CT scans. So again, CTs are presented as a series of slices that you can view by scrolling through the images on a DICOM viewer. So we'll jump into a DICOM viewer here in just a moment. But DICOM stands for Digital Imaging and Communications in Medicine. So DICOM, and it's the standard format used for medical images. So we talked about the PACS system before, which is where these things are stored and then DICOM is the file format that's used within these medical for these medical images. So you can basically think of CT as a serial slice, as a set of serial slices through the body, just like slices of bread through or series of slices through a loaf of bread. And so it's crucial to know how to look at these slices, which again, I've alluded to this a little bit, but there's a couple of key things to keep in mind. So cross-sections from CT scans, and this is the same for MRI as well as for ultrasound, are going to be viewed as if you were standing at the feet of the patient or feet of the bed of the patient and looking up towards their head, okay? So that means that your right, the right side of the screen for you is going to always be the patient's left, the left side of the screen for you is going to be the patient's right. And the patient is always going to be in a supine position. So anterior is always going to be up on your screen, posterior is always going to be down on your screen. This is always the case. So always get yourself oriented in that sense. Think about how you're looking up into the body from below, and they are laying down, feet up, face up, in a supine position. And so anterior is up, posterior is down. Again, this is a really, really crucial thing to keep in mind, and always remind yourself of that, because it's going to make it much, much easier when you're trying to identify the anatomy to make sure that you've oriented yourself appropriately. Okay. So I also mentioned before that you can use contrast agents in CT just like with X-ray, and so it's just important to note that contrast agents are used in more than 50% of CT scans. But again, there's also many situations where contrast media is not going to be used for a CT scan. So just kind of keep that in mind. But let's just look real quick at a CT of the head here. So this is on the website that I put in the syllabus, so MAOS, which you can see up there. So this is just a standard CT scan of the head, and so this is what a DICOM set of files normally looks like, where you can scroll through. So here we're superior, and you can see how the CT scanner, as it moves inferiorly through the patient's head, you can start appreciating the lateral ventricles, which you can see right here, obviously the brain. Again, there's the white hyperintensity or hyperdensity, which is the bone. You can see the frontal sinus right there. Again, and then we can continue down. Here you can see the orbits with the eyes on either side, the nose and the nasal cavity. Here we're starting to see part of the circle of Willis, all this white right through here. So these are going to be representing arteries. Again, you can just, as you kind of walk yourself through, I'm just going up and down right now to look at the various parts of the circle of Willis. So, it's important to realize that, especially with CT and MRI, it's really useful to be able to move back and forth. You really don't want to just look at a single image like this. You really want to be able to look at multiple images at once and in sequence, so that you can kind of imagine what the anatomy looks like as it's progressing. So I'm just going to show you one thing here real quick, just because I think it's helpful. So this is, of course, the cerebellum right here. So you can see these are the two vertebral arteries on either side right there. And so as you follow those superiorly, so I'm going up right now, so we're moving up, up, up. Now you can see where they've merged into one vessel. So that's going to be the basilar artery located right there. And then again, eventually you're going to see that branch off into the posterior cerebral arteries. So you can see there's one of the posterior cerebral arteries right there. And then you should be able to see the other one on the other side here at some point as well, though it is a little bit harder to see. But again, I think you get the idea of how being able to use a DICOM viewer is really powerful when you're looking at CT scans. So here you can see a sagittal view right here. So again, same sort of idea, where you can, you're able to just manipulate the images so that you can see various structures on either side or throughout the patient's entire region of the body that you're looking at. So again, just something to keep in mind, that and be sure to play around with this, just to get a sense of how you might be able to use this throughout the course.